Jake, you ready to help me with this video on treating orthostatic hypotension?
Oh no.
Wow. You look very excited. Come on, I need your help. Greetings out in YouTube land. It's been a while, but I'm still here and I'm back. This video is about treating orthostatic hypotension. Now, by way of quick review, orthostatic hypotension is a fancy schmancy doctor term for the blood pressure drops too much when someone goes from lying down to standing up. How much is too much? Well, the general rule of thumb is what I call the 20-10-20 rule. The top blood pressure number should drop less than 20 when you go from lying to standing. The bottom number should drop less than 10, and that's the definition of orthostatic hypotension. The 20-10-20, the other 20, isn't actually part of orthostatic hypotension, it's the heart rate. In a normal person going from lying to standing, the heart rate should go up less than 20 beats per minute. So, 20-10-20 rule. Now, treating orthostatic hypotension is a combination of basic things in terms of keeping the tank full of fluid. It's some lifestyle modifications, and realistically, I think using medications should probably be certainly not the first treatment of choice. But the reality is sometimes we have to use medications to treat it. We have, seems like 800 medications to lower your blood pressure, and we have like 3 or 4 to raise your blood pressure. So there's not a large number of medical options for that. Now, let's go over what blood pressure actually is. This is mostly because if you remember this and you learn this, you'll actually probably know more about the definition of blood pressure than your doctor. So, blood pressure, it's a very simple formula. Blood pressure equals the amount of blood flowing through the heart, which is called cardiac output, times the resistance of the system, the pipes and tubes that we go through, as we call them, arteries and veins. So our terms for this are blood pressure equals cardiac output times systemic vascular resistance, or the resistance of the system to blood flowing through it. So in treating orthostatic hypotension, in my mind, the list goes drugs, keep the tank full, lifestyle modifications, drugs. First drugs are getting rid of drugs that are lowering the blood pressure. Lots of people have had high blood pressure problems. Often they've had them for years, and sometimes in people who have orthostatic hypotension, I find that 10 or 15 years ago they were started on blood pressure medicine, and their blood pressure over the years has gotten strangely good. It's gotten really good. They come into the doctor and their blood pressure is 112/78, which is kind of surprisingly good. And realistically what's happened is they have developed orthostatic hypotension. They really no longer have hypertension, and the hypertension medications are pushing the blood pressure down too much. So the first drug treatment is getting rid of what we can that lowers the blood pressure. Second is keeping the tank full, adequate fluid. Blood, of course, is mostly water with some salts. So not surprisingly, we say drink lots of water with some salts in it. Preferably some kind of Gatorade, Powerade, sports drink kind of thing. They have a little bit of carbohydrate in them. They have a little bit of sodium salts. They have a little bit of potassium salts. Helps your body hold on to the fluid in your blood vessels a little bit better. Water's good, no problem with water. These kind of sports drink things are a little bit better. Of course, they're generally more expensive than water. Next is lifestyle modification, which is not one thing. It's many different things. Often it's pretty simple things like, gee, I don't jump up when I've been lying down for a while and dash off. I learned that I sit at the side of the bed and kind of dangle my feet for a minute or so, and then because I faint sometimes when I get up too quickly, I stand up from the couch or from the bed, And I sit, just stand there for 20 seconds or so, just kind of make sure that I'm doing okay before I head off. That's great. One of the other lifestyle modifications is avoiding long, hot showers and baths. We probably all have had the experience of being in the bathtub and it's all hot and warm and that's really nice, and then you get out and all of a sudden you're seeing stars because your blood pressure has dropped. All those blood vessels that are supposed to provide resistance are now all nicely dilated and relaxed, and it takes them a little while to kick in. So cooler showers, shorter showers, avoiding the hot baths and hot environments. Large meals, particularly with lots of carbohydrate, but generally speaking, large meals tend to cause our blood pressure to kind of sag a little bit after that. And you can verify this by getting your blood pressure cuff and going around after Thanksgiving and measuring people's blood pressure as they're passed out on the couch. Another lifestyle modification that I often wind up recommending is elevating the head of the bed. Now, this doesn't mean I have 2 pillows on the bed. It doesn't mean elevating your head on the bed. It means elevating the head of the bed. So, if this is the bed, lying on the floor, or it's on the platform, which is on the floor, it means putting some blocks underneath the head of the bed so that the bed itself is at an angle all night long. You usually say go out to the local hardware store and get yourself some cinder blocks or some 2x4s that you can cut and stack up, looking for 4 to maybe 6 inches up. I guess you can't use satin sheets anymore because you probably slide out the end of the bed and wake up on the floor. But all night long, the blood will be running down to your feet a little bit, and that's that kind of stress on the system to make your system accommodate. It's also kind of nice because some people with orthostatic hypotension have very high blood pressure lying down and very low blood pressure standing up. And this is hard on your heart, and it's bad for your brain and other organs. This is hard on everything because you tend to fall. So kind of here is a happy medium, if you will, during sleep. Other lifestyle modifications include limiting alcohol intake, because it tends to cause some of those blood vessels to dilate and the resistance drops and therefore the blood pressure drops. A lot of people talk about using different kinds of compression stockings, and compression stockings can be helpful. You put them up, pull them up over your calves or your thighs or all the way up to the waist. They make them. The firmer the pressure, the more they're likely to help you because they do what the blood vessels aren't doing. They're kind of squeezing down for the blood vessels to increase the resistance. But the firmer they squeeze down, the more effective they are, and the more miserable people are when they have them on. And the really industrial strength compression devices, compression garments, are like a second skin. And generally speaking, my patients say, just about the time I've struggled into that thing, I finally got it on, I got to go to the bathroom. And so I got to say, they play a role, but I find, unfortunately, relatively few people who are all that excited about using compression garments. But if that's your gig, more power to you. So, we kind of gone a little quick cook's tour through some of the things. This is by no means a comprehensive list of everything that can be done to reduce the symptoms of orthostatic hypotension, but it's some ideas. Eliminate the medicines that are driving the blood pressure down. Keep the tank full. Some lifestyle modifications, doing things that tend to cause blood pressure to drop, we're going to avoid those. Giving ourselves time for our bodies to kind of equilibrate and kind of get used to the blood pressures, easing the transition from down to up. Lastly, medications. One of the commonly used medications works more on the keeping salt and water in the body, kind of keeping the tank full side. A couple of the other ones work more on changing the resistance in the system. Not surprisingly, there are patients for whom we use both. None of them is a cure-all. And orthostatic hypotension is essentially often something we manage. It's something that may be a chronic issue for many people, and that we kind of have to accommodate to and do the best we can. I hope you found this video at least a little bit useful. I wish you good neurologic health. Please don't experiment with gravity if you have orthostatic hypotension, because you will probably fall. Thank you.
Thanks a lot for your help, Jake.